My name is Carrie Jones from Bon Secours Memorial College of Nursing, and today we're going to demonstrate putting in an intraosseous line in a patient. Intraosseous infusion is used in urgent or emergent situations where you need an extra line and you need to do it fast. Most of the time, advanced practitioners can do this, but nurses can as well if they've shown to be competent, or a charge nurse or something like that. And the line will actually be going into the bone marrow where there is capillaries and blood vessels, and that's how you can receive medications. So today I'm going to be demonstrating putting it in the proximal tibia site, which is going to be 2 centimeters below the bottom of the patella. And you can use your 2 fingers, and then 2 finger breadths to medial to the patient. So right here is where we're going to go. I've already set up the fluids that are going to be hanging for the patient and primed the tubing, and then we have all of our supplies over here. Usually it comes in a kit, so this is the drill that's going to be being used. All right, and I've already done my hand hygiene and confirmed the correct patient. And we're going to cleanse the area with chlorhexidine wipes for 30 seconds. And we already have the patient in the correct position, like dependent, make sure they're comfortable. Most of the time it's an emergency situation, so they might be unconscious already. But we're going to wipe for 30 seconds to make sure the area is very clean. If it's visibly soiled, you need to clean it first with soap and water, and then you can do the chlorhexidine. And that you'll do that for 30 seconds. Okay, so when you're using the drill, you're going to, we've already gotten our site, and you're going to go perpendicular to the skin. And once you feel the give is when you keep going, and then once you're flush with the skin, like right here, once the needle goes in, then that's when you stop basically and you're in. So we will go to our spot again, and then 2. So that's right here. And then, okay, 1, 2, 3. Okay, we're flush with the skin. This is what it will look like. Okay, and then you'll remove the stylet, and then you have access. To confirm access, you can also use a 5 ml syringe to pulp aspirate blood to see if you have venous access. That doesn't have to be standard practice. I read the research, but that is a way to do it. That doesn't always mean you're not in the bone marrow. And then you can also, you're gonna have to flush saline into it as well. That's another way to confirm placement. So I can go ahead and demonstrate that now. We've primed our tubing with the saline. And if the patient is awake for this, it might be painful. So you'll flush the saline, and we'll pretend like we're doing that now. So if they are awake, it will be painful to flush the saline. So we were able to flush. So either you or the advanced practitioner can inject lidocaine into it as well, and that'll make the pain go down, because that can be kind of painful, the saline going into their bone marrow. Alright, so we're going to go ahead and connect our tubing with our fluids for the patient, so they will have another line. It's connected to this. We'll add a secure dressing to the top. Oh. Okay, we got our secure dressing that came in the kit. You can also draw labs from that as well if you have your lab tubing and your labels all printed out. And then we'll take our marker and we'll label it when we put it in, and we'll document it as well into the chart, because an IO line is only good for 24 hours. You're going to want to take it out after 24 hours. And at that point, you've already probably established another line in your patient if you need to. So that's it.